We have all worked with that one individual who acts as a literal black hole in the clinic, an energy drainer who leaves the rest of the team feeling like a squeezed out wet rag by the end of a morning session. In our high-stakes orthodontic environment, this is not just a personality quirk, it is a clinical contagion that quickly infects patient care and stalls your operational flow. Often, this negative energy is not just about attitude, it is carried through specific, repetitive phrases that act as linguistic traps, killing initiative and halting any progress toward true excellence. When a clinical assistant says, "That's just how we've always done it," they are not just resisting change, they are essentially closing the door on innovation and setting a hard ceiling for your practice's growth and your team's morale. True dental leadership involves identifying these verbal bottlenecks and replacing them with an empowered vocabulary, because as the clinic owner, you must model the precision you expect to see at the treatment chair. This transition is not merely about semantics, it is about fundamentally re-engineering the psychological framework of your entire team. The first and most critical shift is moving from "I hope" to "I will." In the world of lean orthodontics, hope is a dangerous luxury we cannot afford. Hope is not a strategy, it is a public declaration that you have no control over the outcome. When a team member says they hope the afternoon won't be stressful, they are resigning themselves to a reactive state. Contrast that with an empowered team member who says, "I will do what is necessary to manage this flow." This is the hallmark of a high-performance mindset, where every individual feels a personal responsibility for the success of every patient visit. Think about your treatment coordinator following up on pending contracts. Instead of hoping a patient calls back, an empowered TC states exactly when they will call the family to resolve any financial barriers. In our morning briefings, we do not just hope the bus of patients doesn't overwhelm us. We actively map out the specific roles and room rotations to ensure success. We look at the schedule through a lens of systems and identify potential bottlenecks before they manifest as patient wait times. This approach eliminates the administrative ballast of uncertainty and ensures that every member of the team feels capable and grounded, even during the heaviest rushes. When your team uses solution-oriented language, their focus remains on the clinical flow rather than the perceived stress of the volume. This shift from passive observation to active commitment is what allows a practice to scale without losing the quality of the patient experience. It transforms your staff from employees who are simply getting through the day into stakeholders who are actively driving the practice's success. When an employee says, "I can't," we must recognize it for what it truly is: a signal for better systems or more targeted training. It is rarely a sign of laziness. More often, it is a symptom of a structural deficit in the practice management. As a leader, your primary job is to convert that "I can't" into a strategic "how can we?" This immediately shifts the focus from a dead-end wall to a problem-solving exercise, encouraging the team to audit the process rather than blame the person. If an assistant feels they cannot independently fit a complex appliance, the solution isn't criticism. It is providing the video documentation, the standard work document, or the direct coaching they need to succeed. Replacing "I can't" with "I'm looking for solutions" keeps your practice in a state of continuous improvement, which is the very essence of Kaizen in the orthodontic world. This focus on small daily refinements leads to massive long-term results and prevents the yo-yo effect, where a practice runs well for a few weeks before collapsing back into old limited behaviors. Sustained growth requires a language that supports constant expansion and learning. In a competitive market, the team that instinctively asks how instead of saying can't will always emerge as the market leader. Furthermore, we must address the do mindset by eliminating the psychological safety net of trying. In lean orthodontics, the most successful practitioners are those who take the first concrete step immediately. They understand that waiting for perfection is the ultimate enemy of progress. While other offices are still trying to find the time to implement a new clinical analysis or a delegation protocol, high performers have already integrated it and are seeing the data. Trying is a subtle form of inactivity that allows us to feel productive without actually achieving anything. To put your practice on a true autopilot, you must push your team to focus on action. If a sterilization workflow needs optimization, don't try to change it next month. Change one specific bin placement today. This bias toward immediate action is what creates that Swiss watch rhythm in the clinic, ensuring the patient journey remains smooth, predictable, and remarkably free of avoidable delays. The words we choose have a lasting impact on our professional reality and our personal well-being. By systematically removing energy-draining terms, you protect your own clinical energy and foster a culture where excellence is simply the standard. Start today. Listen for those deadly terms in your hallways. Replace them with active commitments and watch your practice thrive. The transformation begins with the very next sentence spoken in your office. Thank you for your time, and I'll see you in the next video.